Welcome to the American Institute of Healthcare Professionals video on problem management model in counseling. And this is part 4 in our micro counseling series in helping individuals understand how a counseling session would go. And this problem management paradigm that is set up is a good structural way to understand how to identify issues, where to change and where to go from that identification, and to promote real change. So while we don't want to put anyone in a box, we still do want to have some sense of direction. We don't want to necessarily be a counselor who just wings it every other session or so it's important, if you're in grief counseling or any of the other mental health counselings, whether it's just at a pastoral level or whether it's at a clinical level, to have some type of outline, some type of blueprint where to go. And this is what we refer to as our counseling direction. And this is what the problem management model gives. It gives structure, it identifies the issue, and helps find a course of action. And it's similar in structure to Carl Rogers' 5-stage model. Within Carl Rogers' 5-stage model, there's first building a rapport with the client, in which the client builds a sense of trust with the counselor, and that involves, like we mentioned in the first video, attending to the client, building that empathetic foundation of trust, and also being a counselor who understands the situation. So the second element of Carl Rogers involves story and strengths of the particular individual's event or problem that they are discussing, the narrative, so to speak. And that involves good listening skills and also good responding. Following that is a time to begin to identify what needs to be done. And in doing so, Carl Rogers lists his 4th stage, the re-story, where the individual looks at things from a really first time, a true lens, maybe not just their story, but the real story, and what needs to be done, what actions need to be taken. And finally, his action stage, where the individual actually puts goals into implementation with the aid of the counselor. So similarly, the problem management model is a map and arrow to keep the sessions on track, to guide the individual throughout the various sessions, depending on where you are. Now, bear in mind, that doesn't mean that it's always sequential. There will be times when there are relapses with a client, so it's not always going to be going forward, unfortunately. But like human beings, no one is perfect. And this is why the counselor must maintain flexibility, but still navigate and have the session successfully through direction. So the problem management model has 4 questions. The first phase in questions involves, I like to refer to it as, in many of the Egan and Ivy textbooks, as the current picture. This is identifying the story and helping guide the client to the real story. Now, you've heard this through 3 of our videos already, their story and the real story. And we will do a future video in this series also on that. But right now, the idea is to identify the current picture of the individual. And that's, again, through attending and basic listening skills that the counselor has, understanding exactly what is going on. Now, the second phase of the counseling session should eventually begin to steer towards the preferred picture. It's helping the client identify what he or she desires or needs and discussing the possible goals and possibilities. And this was things that we discussed in video 3 about change, confrontation, and goals. The third phase involves viable options and plans, and picking the best options and strategies that fit the client, and a concrete plan on how to accomplish this preferred picture. The fourth phase is actually implementing this call to action with assessment on the progress, any readjustments, and accounting for relapse, and also resiliency in overcoming any mistakes one might make. So these phases can take multiple sessions and they can revert back and forth between these particular phases. But essentially, when you first meet an individual, a client, you're dealing with their current picture, and then eventually you proceed to a preferred picture, which implements how to reach that preferred picture and the action and the continued management of reaching that change in action. Now, like the third video, we did discuss a lot about clients and change itself. Some clients are more resilient and motivated within the problem management model. Others are less motivated. Some need more encouragement, and some might even need empathetic confrontation, as we saw in the third video. So clients and change involve discovering the awareness of the issue, but also a heightened awareness of the issue of the person wanting to change. And this is how counselors need to be a catalyst for change. They need the clients to see that the change is necessary, but also desire to do it. So clients will then begin to analyze the weight and cost of the change itself, sort of like what we discussed in the third video on the CCS model, the client change. So once this rational decision to make a change occurs, the emotional decision also simultaneously begins to take root within the individual, where it's not only a thought, but it is something that is willed beyond just the intellect. And it promotes this conscious move to make the change. But the counselor needs to be aware that the client might have relapse and there might be basic maintenances that are needed. Now, once this change is established, the necessity of it, the counselors need to have to plan, or in other words, quote unquote, mine various new philosophies in their background that they have for ideas to help their client. This involves the counselor going back into their academic background and being able to use their skills that they've developed or their philosophies that they've been taught and learned and actually mine them in a way that fits best for a flexible plan for their particular client. Now, the problem management model is the overall structure and paradigm for this, but the counselors need to understand that they need to be flexible in that regard. Some systems might interact with other systems of thought. What might be good for one client might not be as good for another. So the counselors need to evaluate and weave what works best for a particular client. The counselor needs to be flexible and also educate the client about the plans. In fact, the client should be told in a psychoeducational way what the change model is all about, the problem management model, what it entails, and where they are now and where they wish to be. And so this helps the client move forward. Now, in the final phase of change, the action phase, it's up to the counselor to help the client move forward and not become stagnant, and to also foster resiliency and become encouragers and coaches for change when clients relapse or possibly fail. So if you are working with an individual, you're going to be using the various micro skills discussed in the various videos, but the problem management model is an excellent blueprint to look at as you work your way through with all the other minor, many, numerous details that go with a particular client. Below is our grief counseling certification link, as well as our Christian counseling. As I've said in other videos, we also have crisis counseling, so stress management, anger management, spiritual counseling, and those can all be reviewed on our homepage. Our phone number is 330-652-7776, and our email is info@aihcp.org. Again, our reference is Egan, the Skilled Helper, a problem management and opportunity development approach to helping. I would like to thank everyone for listening and have a good day.